For millions of people, chronic pain is more than just an ache. It's like this constant disruptive signal that just takes over your whole life. But what if we started thinking about the problem differently? What if the problem is the signal itself? That's what we're going to explore today, a technology that does exactly that. We're talking about spinal cord stimulators, and you'll often hear them called a pacemaker for pain.
So, let's try a thought experiment. Imagine your chronic pain isn't just a feeling, but it's actually a technical problem, like a faulty electrical signal that's just firing over and over and over again through your body's wiring. Honestly, shifting your perspective like that is the absolute key to understanding how this incredible technology works.
A really good way to think about neuropathic pain is to picture a fire alarm that just won't shut off. The fire was put out a long time ago. Maybe the original injury has even healed completely. But that pain signal, it's stuck in this relentless loop, screaming at your brain about a danger that just isn't there anymore. So, the real question is, how do you turn off a faulty electrical alarm?
Well, it turns out you fight electricity with electricity. It's kind of brilliant, right? If the whole problem is a rogue signal, then the solution has to be a device that can intelligently step in and override it. And that's exactly where this idea of a pacemaker for pain, a pacemaker for your nervous system, really comes into play.
And look, this isn't just some clever analogy we made up for this explainer. This is literally how doctors and physicians explain it to their patients. The very same principle that lets a cardiac pacemaker correct a faulty heartbeat can be used to correct faulty pain signals. Why? Because when you get right down to it, our nervous system is basically a biological electrical grid.
Okay, so the official medical term for this whole process is neuromodulation. Now, I know that sounds super complex, but don't let the word scare you. All it really means is modifying or altering nerve activity. By applying these really gentle electrical pulses, we can literally change the message the nerves are sending to the brain. We're not just masking the pain you see. We're getting in there and actually intercepting and changing the signal itself.
All right, so how does it actually work? What's the science here? Well, it's all based on a really cool idea called the gate control theory. And the best way to think about it is, well, it's like finding a way to close the gate on those pain signals before they can ever even reach your brain. Let's break down exactly how that happens.
Okay, first things first, let's talk about placement. Thin, flexible wires, we call them leads, are carefully placed in what's known as the epidural space. That's the area around the spinal cord. And this is so important to understand. They never actually touch the spinal cord itself. From that safe position, they can deliver these tiny, gentle electrical pulses right where they need to be.
So I want you to picture your nerves as a giant highway leading straight to your brain. Now those snagging pain signals, they're stuck puttering along in the slow lane. What the stimulator does is it activates these other nerve fibers, the big, fast ones that cruise along in the express lane. And because those express lane signals get to this gate in the spinal cord first, they basically tell it to close, effectively blocking the slow-moving pain signals from ever getting through. Pretty smart, huh?
Okay, so you might be wondering, who is this actually for? And that's a great question. Let's walk through what the patient journey typically looks like. Because it's really important to understand, this isn't a first step. This is an advanced option for people who have, frankly, already been on a very long and difficult road.
Now, this is crucial. This device is not for every type of pain. It's designed specifically for what's called neuropathic pain. That's pain caused by actual nerve damage. We see this in conditions like failed back surgery syndrome or something called CRPS, which is a really severe chronic pain condition. To even be considered a candidate, you have to have already tried the more conservative options, physical therapy, medications, and they just haven't brought enough relief. And just as important, there's a full screening process, which includes a psychological evaluation to make sure this is truly the right path for the patient and to set them up for the best possible outcome.
So if you look at a typical timeline, the journey often starts with the onset of chronic pain. Then you'll see maybe 1 or 2 years of trying those conservative therapies we just talked about. It's only after that an evaluation for an advanced option like spinal cord stimulation might happen. But I want to draw your attention to that fourth step there, the trial period. This is probably the most critical part of the entire process.
Here's the deal. Before anyone even thinks about getting a permanent implant, they go through a trial period with a temporary external device. And for that trial to be considered a success, for everyone to agree to move forward, it has to show at least a 50% improvement, either in pain levels or in daily function, like being able to walk more or sleep better. That's the benchmark, 50% or more.
And honestly, this is what makes the whole process so unique and frankly, so brilliant. It's like the ultimate try before you buy in medicine.
It just takes all the guesswork out of a massive medical decision. You, the patient, actually get to live with the therapy for several days to see for yourself if it truly works for your specific pain. It's an incredible safety check that's built right into the procedure.
Of course, with any medical procedure this advanced, it's absolutely essential to have a clear-eyed view of what the outcomes really look like, right? So what does success look like, and what are the potential downsides? Let's take a moment to weigh the risks and the rewards. So, when we look at long-term success, what are we talking about? Well, studies show that about 50 to 60% of patients, so over half, get at least that 50% benchmark of pain relief. And for those people, that can be absolutely life-changing. It can mean getting back to a job or playing with their grandkids again. But we also have to be realistic. For about 40 to 50% of people, it provides less relief. So while it can be incredible, it's so important to know it is not a guaranteed cure.
And naturally, we have to be upfront about the risks. This is an implanted device after all. And just like any surgery, there are potential complications we need to talk about.
Okay, so the most common issues are actually related to the hardware itself. For example, the little wires, the leads, can sometimes move out of place. We call that migration, and it happens in about 14% of patients. Other risks can include things like pain at the implant site where the battery is, or of course, infection. These are exactly the kinds of numbers you would discuss in detail with your doctor to really weigh your own personal risks and benefits.
All right, so we've covered the what, the how, and the why. And what we really want is for you to leave this feeling empowered. Think of this explainer as the starting point, the foundation for your next, much more informed conversation with a healthcare professional.
So let's just quickly recap the 5 most important things to take away from all this. Number 1, think of chronic nerve pain as a faulty electrical signal. Number 2, the device acts like a pacemaker for pain to interrupt that signal. 3, this is an option for nerve pain after other treatments haven't worked. 4, you always do a try before you buy trial first. And number 5, it's all about balancing potentially huge rewards with real known risks.
And we'll end on this thought. Now that you understand the basic idea, the process, and the potential outcomes, you're so much better equipped to have a meaningful conversation. So the real question to ask yourself is this: could a pacemaker for pain be an option for you or for someone you care about? If the answer is maybe, then the next step is simple. It's to talk with a pain management specialist to find out if you might be a candidate. And that's how information turns into action.